Yes, Dr. Ahmed, we can hear you.
Yes.
Okay. So today we are going to discuss the MSK pathology. Can you guys see my screen?
Yes.
Yes, we can.
Okay. So have you guys done your have you guys started doing your neurology tasks?
No.
Yes, like most of the neuroanatomy, you are going to see involvement of the like all of this system. Like 80% consists of the MSK, like those nerves and claw hand and so do the anatomy portion. Tomorrow I'll be discussing the anatomy and I'll just try to finish all the neuroanatomy within 3 days, right?
Doctor, I have a question regarding the assessment. The MSK assessment will be alone or together with the neurology?
Sorry, can you just repeat it?
Uh, the assessment for the MSK, it will be together
Yes.
with the neurology or it will be alone?
Okay, so I'm planning that we should take NBMEs, right? Will be for once we are like once we start our, as I have already told you guys, and at the end of MSK, once we start doing neurology, we'll be giving NBMEs, right? So from now on, the assessment would be based on NBMEs, right?
All right, it's not the individual systems, right?
Yes. Now, like you guys should practice doing NBMEs because you are already left with three systems, right? So individual assessment, I'm like not in favor of that. I'm like personally in favor of giving NBMEs,
Okay,
right?
thank you.
Okay. So the first disorder which we'll be discussing here is achondroplasia. Achondroplasia. Yes. Anyone who can just debate what's achondroplasia as the name indicates. Okay. Yes. Under development of chondrocytes, that are your cartilages, right? Okay, so this one of the cause of achondroplasia, that is mutation. But remember, guys, very high yield. It's an activating mutation. What do we mean by activating mutation? Like you are going to activate certain genes, right? And that activating mutation is going to inhibit the formation of your chondrocytes, right? Or disrupt the formation of chondrocytes. So it's an activating mutation, right? Okay, it's
Mm-hmm.
an activating mutation of what? It's basically FGFR3, right? It's an activating mutation of FGFR3. So what happens? Okay, basically it happens in autosomal dominant fashion, right? So as a result of that, you'll be seeing like abnormalities in the formation of your chondrocytes, that is cartilage, right? So overexpression of FGF3 is going to inhibit the cartilage formation, right?
Mm-hmm.
Okay, so guys, you know that we have two processes in which mainly our bonds is formed. The one is like intramembranous bond formation. Like first of all, you are going to see formation of membranes, and then you are going to see ossification of those membranes, and as a result of that, you will be seeing the mature bond being formed. And secondly, what happens? First of all, like this is the first method of formation of bone, and the second way how the bones are formed. First of all, you are going to see the formation of cartilages, right?
Mm-hmm.
Cartilages, and that cartilage are going to then become calcified, and this calcification is going to give you mature bones, right? So this is basically known as intramembranous bone formation, intramembranous bone formation, and this part is basically known as your
Endo.
endochondral, as the name indicates, bone formation. So can you guys tell me that intramembranous ossification takes place in which bones? Yes. Flat bones, perfect. For example, your skull, right?
Mm-hmm.
Your sternum,
Mm-hmm.
right? And endochondral bone formation, basically your long bones, right? So
Mm-hmm.
whenever you have achondroplasia, that is activating mutation of FGFR3, it's going to mainly affect your endochondral bone formation, right? So
Mm-hmm.
if I am affecting the endochondral bone formation, it means that what would happen? Yes, what would be the clinical features of this individual?
Short stature.
Okay, short stature.
Mhm.
Then
Only long bones. The
okay,
torso and dorsum will be normal.
yes, like long bones are affected as we have seen here. So he would be having like mental functioning, good lifespan, no anomalies of his skulls, his sternum. Only his long bones are going to be affected. So as a result of that, he would be short. Okay, he would be having short stature. Okay, the second pathology which we are going to discuss is osteogenesis imperfecta. Okay, how to look for that what happens in this disease? Just look to the imperfecta or one, like one perfecta, right? So it means that in this condition you are going to see, yes, defect in type 1 collagen form, type 1 collagen, right? Imperfecta 1, type 1 collagen. Okay, type 1 collagen is present in your bo1, right? It's your, not your bone, it's b1, right? So how to remember that bonds have type 1 collagen? It's B1. Okay, it's not bond. So secondly, type 1 collagen also forms your sclera, the white portion, right? So for example, if I have defective type 1 collagen, it means that your sclera is going to become thinned, right? No collagen, so you'll be seeing thinning of sclera. And this thinning of sclera is going to give you blue color. Okay, it's very high yield. You are going to see an MCQs. Why are we seeing blue color? Because due to exposure of the underlying choroid veins.
Yes.
Like normally if you see in the textbook, veins are blue, right?
Yes.
So it means it would give you, if you are thinning the sclera, so it would give you blue color of your sclera or bluish sclera. Okay, so over here we already discussed that it's B1, right? Bone. So you will be seeing multiple fractures, right?
Yes.
Okay, so multiple fractures because you are going to see disrupted bone. Another thing, our the three bones which are involved in hearing. They are also bones. They are also B1, right? So you're going to see hearing impairment, right? That is Malleus incus stabilis, right? So hearing deficits. Okay. So this was all about osteogenesis imperfecta. You are going to see MCQs related to type 1 collagen, this blue sclera. Why? It's due to choroid veins, right? And hearing as well. Okay. The next disorder which we are going to study is our osteopetrosis. Okay, we would just look towards the name. Petrous mean, yes, rock, right? So you are going to see rock-like bones, but not in terms of the strength. Remember that. Okay, so you are going to see rock-like bone. It means you are going to see thickened bone, right? Okay. Can you guys just tell me that how does the bone, how is the bone formed? For example, if I am forming the bone, you have certain kind of cells which are involved in the formation of bone.
Osteoblast.
Okay, osteoblast, and you have osteoclast, right? Okay, so it means that osteoblast. Okay, let me just draw. Okay, it means that osteoblasts would form your bone, right? Okay, can you just tell me in which environment you are going to see bone formation? In acidic environment or alkaline environment?
Alkaline.
Perfect. So alkaline environment, right? Okay, osteoclasts are going to break off your bone, right? Okay, in which environment?
Acidic.
Acidic environment. Perfect. So if I want to activate the osteoclastic side of the like you always have osteoblast and osteoclast working in like in combination with one another. How? Because in order to activate your osteoclast, basically osteoblast does that. How? It's going to activate a receptor that is known as
Rank.
rank L. And once it activates a rank L, it's going to recruit more osteoclasts, right? Okay. So for example, if I am having difficulty with this osteoclastic activity, right? If I'm having some problem with the osteoclast functioning, so what happens? This side is going to dominate, right? Osteoblastic activity. Okay. Once it dominates, it means you're going to see more bone being laid down. More bone being laid down. So it would just give you a rock-like appearance, like hard, thickened bond, right? Thickened bond.
Mm.
But what's the problem with this thickened bond? It isn't basically rock like in a strength. You can simply imagine of a chalk, right?
Mm.
You know, like you have a black board and a chalk, right? And it breaks very easily. So
Mhm.
although they are thick, but you can just simply imagine of a chalk, but
Mhm.
they are going to break very easily,
Easily. Mhm.
right? Okay. So till now we have studied that we have problems with the osteoclast. If you have poor osteoclast functioning, you are going to see more osteoblasts being okay, this activity is increased. Okay, we also studied that is the alkaline environment is going to trigger the osteoblastic activity, and acidic environment is going to trigger your osteoclastic activity, right?
Mm.
Okay, so normally we have an enzyme, if you guys remember. What's the function of carbonic anhydrase? Yes.
Like carbon dioxide. Yeah, carbon
Convert
dioxide
CO2
and
plus
water.
H2
CO2 plus
into bicarb.
H2O is equal
Yeah.
to
Bicarb.
H2,
H2CO.
yes, bicarb plus H plus, right?
H
Yeah.
plus.
Through carbonic anhydrase enzyme. Like for example, if my carbonic anhydrase enzyme isn't working, it means the acidic environment isn't formed.
Mm-hmm.
Okay, so what's the reason of disrupted osteoclastic functioning? It's due to mutation that affects your carbonic anhydrase, right?
Mm-hmm.
Okay, so whenever the carbonic anhydrase isn't functioning, so it means you won't be forming that acidic environment for the osteoclast to function, and as a result, to eat your bones. So as a result of that, osteoblastic activity increases, and it would give you thick bones, right?
Mm-hmm.
Okay, another thing, whenever your bone become thickened, okay, this is your cortex of your bone, and in the mid you have medulla, right? In the medulla you have your bone marrow, and they basically participates in formation of different kind of cells, that is red blood cells,
Mm-hmm.
thrombocytes, right, leukocytes. So this thickening
Mm-hmm.
is going to invade the medullary portion as well, so it means it would disrupt the normal hematopoiesis, right?
Yes.
Okay, so disruption of normal hematopoiesis. Okay, we'll be seeing some problems with the vision, with the hearing impairment. Yes, you guys are going to tell me why. You are going to see hydrocephalus. Just think of it's a common sense. Perfect. Like the nerves go through a foramen, right?
Mm.
Okay. If I have this like exaggerated activity of osteoblasts, it means these foramen are also going to become narrowed, right? It would impinge upon the nerves, like
Mm.
for the vision, your optic nerve, your hearing, vestibulocochlear nerve, right?
Mm.
Hydrocephalus, you know, this is your brain. Your brain come out of a foramen that is known as foramen magnum, right, inside your skull. So if I am thickening it, I am laying more bone. So again, what happens? The CSF that is present around your brain, which we'll be discussing, you're going to impinge this portion. So you're going to see hydrocephalus. What's hydrocephalus mean? Like water in your brain, simply hydrocephalus, right? So CSF
Mm.
would build up inside your brain, giving you hydrocephalus. There are certain types of hydrocephalus which we'll be discussing, the communicating and non-communicating. But one of the cause can be, yes. Okay, we discussed tubular acidosis, if you guys remember. It was also related with the carbonic anhydrase
Mm.
2 mutation, right? For example, as you guys know, whenever the H plus is formed, H plus is going to move out. It's going to undergo this reaction in opposite direction, and as a result of that, one HCO3 is going to be reabsorbed, right? We know that.
Mm.
Whenever H plus move outward, one HCO3 is reabsorbed, right?
Mm.
Okay, so if we aren't forming H plus, it means we aren't reabsorbing HCO3. I am not reabsorbing HCO3, so it would lead to acidosis, right?
Acidosis. Mm.
Okay, and what's the problem? The problem is with the tubule that aren't forming carbonic anhydrase, so it's renal tubular acidosis.
Mm-hmm.
Okay, what's the treatment? What do you guys think? What might be the treatment? Just give them marrow transplant.
Yeah.
Why? Sorry, I can't hear you, Dr. Futures. Can you say it loudly, please? Hello? Okay, okay. It's very interesting. Here, guys, just focus. Okay. You know, these osteoclasts, we have already learned that monocytes are going to enter various tissues and they are going to be converted into macrophages, right?
Mm-hmm.
So simply you can think of the macrophages of your bone are known as your osteoclasts, right? Right?
Yes.
Okay. So it means they are the macrophages of your bone. It eats things, right? So monocytes come from your bone marrow, right? That myeloid lineage.
Mm-hmm.
So I would just give them bone marrow transplant and these cells are going to be corrected.
Yeah.
Okay. Okay. So now let's discuss another condition, that is rickets and osteomalacia, right? That is rickets and osteomalacia.
Doctor, can
Okay.
you re-explain the treatment?
Okay, so we discussed like simple in order to make sense out of it. Simply, you can think of that monocytes. What are monocytes? They have come from your myeloid lineage, right? They roam around here and there in your blood, and they enters different tissues. For example, whenever they enters liver, they are known as Kupffer cells, right?
Mm-hmm.
So their name changes. Whenever they enter your bone, they are known as osteoclasts, right? So they comes from monocytes. Monocytes come from your bone marrow. So give them bone marrow because the main problem here is the underactivity or due to mutation affecting the acidic environment and osteoclasts aren't formed, right? So treat them from the baseline. Give them bone marrow transplant. So then you are going to see like normal osteoclast being formed, and when normal osteoclast form, you won't be having increased activity of osteoblasts, and as a result of that, osteopetrosis, right?
Yes, thank you.
Okay. Okay, so now let's discuss ricket and osteomalacia. Can you guys tell me that the main cause of rickets and osteomalacia, and can you guys differentiate it?
Vitamin D deficiency.
Okay, perfect. Vitamin D deficiency. Okay, can you differentiate rickets from osteomalacia? Single differentiating point.
Rickets is in children. Osteomalacia
Yes,
is
it's in children, it's in adults, right? So normally your osteoblasts do not form directly your bone. It lays down a substance which is known as osteoid. And osteoid then become mineralized with calcium, and as a result of that you are going to see the mature bone then, right? Osteoid. So for example, if we have vitamin D deficiency, we already know vitamin D is going to act on your GIT. It's going to reabsorb your calcium plus your phosphate, right?
Mm-hmm.
Okay, bone also need phosphate. Okay, so whenever we do not have calcium, so it means you cannot mineralize your osteoid, right? If I cannot mineralize my osteoid, so it means the integrity of my bone is going to be lost, right? You have osteoid, you do not have any mature bone, because in order to mature this osteoid you have to lay down calcium onto it, right?
Mm-hmm.
Okay, so if it happens in the children, it's going to give you a condition known as rickets. If it happens in the adults, it's going to give you osteomalacia, right? So osteoid deposition does not take place. What are some of the causes of low vitamin D? Yes, you guys know that we have already discussed. Hello.
CKD.
Okay, decrease exposure to the sun. We already discussed. Sun is going to fall on the cholesterol are going to convert into 25 in your liver, then it's going to go into your kidney, and 125, right? And what about 125? 1 is present in your proximal convoluted of your tubule of your kidney. For example, if a person is having chronic kidney disease, it means again you're going to see less vitamin D being formed, and again you're going to see rickets and osteomalacia, right?
Mhm.
Okay, for example, if there is liver failure, okay, again we are going to see vitamin D deficiency, right?
Mm-hmm.
Yes.
Okay, so rickets is due to low vitamin D in children, right? Children rickets. Okay, so it most commonly arises in children less than 1 year of age. You are going to see pigeon breast deformity. What is pigeon breast deformity? Your sternum is going to move inward and your ribs are going to move outward. So it would be just giving you a pigeon shape. Okay, let me draw a pigeon. Okay, like that. Okay. So sternum move inward and your ribs move outward. So it's going to okay, due to this bending, it's going to give you frontal bossing. What is frontal bossing? For example, if the accumulation of if you have, okay, so for example, if I am not mineralizing this osteoid, it means your osteoblast is going to work more. Like it would lay down more osteoid. So for example, if the osteoid is laid on the front of your head, so it's going to give you frontal bossing, right? Protrusion of your this bone, the forehead bone, right? Okay, it's going to give you a condition that is known as rachitic rosary. What is rachitic rosary? Anyone who can tell us?
Swelling at the poststernal
Your voice is too slow. Please, can you just hello?
swelling at
Hello?
the poststernal junctions.
Okay, so what is rosary? Basically, like it's if you guys have seen that beans on which people like the monks worships, right? That is basically known as your rosary, right? They count whatever they are saying. So it means you are going to see formation of beads. This is basically a rosary, and rachitic, it happens in rickets. So on the costochondral junction, you are going to see these beads, right? And it would just resemble this rosary, right? So you're going to see rachitic rosary. Don't just confuse yourself by this rachitic rosary name. So it's simple. So why again the osteoids are going to deposit in the costochondral junction, giving you rachitic rosary, right? Okay. If I have osteoid, it isn't mature, right, in your legs. So it means the legs would bend. So you're going to see bending of legs because the osteoids are delicate. They aren't hard as your mature one, right? So inadequate mineralization. Okay, what would be the laboratory findings? Yes, what would happen to the serum calcium if you do not have vitamin D? Yes,
Decrease.
decrease. What happens to serum phosphate if you do not have vitamin D? Again,
Decrease.
Decrease.
okay. If I have decreased calcium, I have a hormone that is going to increase.
PTH.
PTH.
Increase PTH. Perfect. And what happens to the osteoblast activity increases, right?
Yeah.
Yeah.
Like it's laying down osteoid, but you do not have mineralization of that osteoid. So
Yeah,
increase osteoblastic activity. How to check whether my osteoblastic activity is increased? Just look towards the alkaline environment. If I have increased alkaline phosphatase, it means osteoblastic activity is increases. So in the laboratory findings, you will be seeing increased activity of alkaline phosphatase, right? Okay, so you're going to see a lot of MCQs related to this rachitic rosary. Okay, this bending. So you might have done you guys have done the MCQs, right? So this is only revision session for you guys now. Okay, another condition which is osteoporosis. Okay, what happens in osteoporosis? You have reduction in the trabecular bone mass. Like normally, what happens that you have a term that is known as peak bone mass. What's peak bone mass? Yes, like at the age of 30, you are going to see the maximum and the mature bone being formed. After 30 year of age, it comes on declining, right? So this peak bone mass is basically dependent on certain things. That is your exercise. For example, if a person is exercising more, it means his peak bone mass is going to be more. He's going to have more healthy bones. Secondly, it's also dependent upon the diet, right? For example, if he's taking good amount of vitamin D. And thirdly, with genetics, right? That is vitamin D receptor. So osteoporosis, basically the main goal behind osteoporosis is that all of your laboratory examination are going to be normal. Okay, it's high yield. Whenever you have normal laboratory testings and still you have weakening of your bone, so it basically suggests osteoporosis. Okay, let me give you some renal tie-in. For example, if a person is having osteoporosis and he built more amount of yes, he's like having more amount of fluids inside his body, and I would just give them a diuretic. Which diuretic am I going to give them? You were MCQ. Thiazide, yes.
Thiazide.
Thiazide diuretic, because it reabsorbs your calcium, so it helps individual with osteoporosis. So Risk of osteoporosis. Okay, how to improve this decline? Again, these three factors. If I'm having good diet, if I'm having excessive exercise, so the decline would also be low, right? Hello. And
yes.
you guys know, okay, can you guys tell me that which hormones protect your bone?
Estrogen.
Okay, estrogen. Okay, and destructive for your
Steroid.
bones. Okay, glucocorticoids, right, or steroids. So this was the whole idea. You are going to, okay, so it's basically due to increase osteoclastic activity if I'm eating the bone, right? Okay, so we basically have a drugs group of drugs which like destroy your, okay, you are going to see an MCQ related to it. I'm just discussing it. Okay, that destroy your osteoblast. What's the name of that?
Bisphosphonates.
Perfect, bisphosphonate. So what happens? Osteoclasts are going to eat your bisphosphonate, and bisphosphonate are going to kill your osteoclasts, apoptosis, right? So give them osteoclasts. Okay, so the next disease which we'll be discussing is then Dr. Renu is going to give us an overview of all of these diseases. Is your Paget disease. Okay, so what happens in the Paget? Anyone? Yes. Okay, what happens in Paget disease? What's the initial trigger for the Paget disease? Anyone? Okay, so can I just say it's a Paget disease? This C is going to remind me of osteoclastic activity first. Right? Classic activities. So whenever you have increased osteoclastic activity, it means your bone is, okay, osteoclasts are going to eat your bone, right? Okay, whenever the bone is eaten, what happens? Then osteoblast would come into play, and osteoblast would think that I have like very weakened bone, so it would lay down osteoid, and it would like try to mineralize that bone, but it's going to do all of these things in rush, right? So the bone which osteoblast is laying won't be that hard, right? So you are going to see weakened bone, right? So initially you are going to see activity of your osteoclast, right? Then you have mixed osteoblastic and osteoclastic activity, right? And in the end you are going to see osteoblastic activity. Like the idea is whenever the bone is weak, you know, osteoblasts are going to lay down bone, but it would do this process in a rush, so the bone won't be formed that well, right? It would be weakened, not the like hard and strong bone. So this is the main pathophysiology of Paget disease, right? Okay, so for example, if we have weakened bone, so we can have bone pain, right? Because you are going to see micro fractures. Okay, if increase osteoblastic activity, again what happens to the head size? Laying down more bone, but that bone is laid down in rush, right? It isn't that well, so you're going to see increased head size. Okay, or for example, this osteoblastic activity involves your faces, so you're going to see leonine faces or loin like faces. Okay, and what happens to alkaline phosphatase activity?
Normal.
Increase.
Alkaline phosphatase increase osteoblastic activity in the end. So alkaline environment, yes, alkaline environment would increase.
Yeah.
Okay, what would be the treatment option? Okay, this pathology was initiated by the class. It's Packett's disease, right? So give them bisphosphonate, kill those osteoclasts, right? Give them calcitonin. Okay. Okay, another important very high yield you are going to see an MCQs. For example, if we have increased osteoblastic activity, right? And we are laying down the bone in rush, so the blood vessels in the bone can just be disrupted, so it leads to, yes, AV shunts, right? If I am forming more bones, the osteoblastic activities is increased, So the blood vessels which are coming to these osteoblasts, they are going to mix up with one another, and as a result of that, you can have AV shunts. And you know, AV shunt are going to lead to high output cardiac failure, right? You might have done an MCQ related to it. Okay, and here if I am forming the bone in rush, like a lot amount of bone, so it means that there is increased chances of mutations, right? These mutations can lead to, yes, osteosarcoma. That is malignant cancer of your bone, which we'll be discussing further. Okay, so now we have another condition. Okay, so Dr. Renu, can you just please give us an overview of all of these diseases, a quick overview. Dr. Future is going to help you with that.
Okay. So the first one is achondroplasia. So the cartilage is not forming, defective cartilage formation. It's because of the activating mutation of FGFR3. And bone formation happens by like two methods, that is intramembranous and endochondral. So intramembranous is like, you know, it's happening like in the flat bones, sternum, and your skull. And endochondral is first your cartilage is coming and then it is calcifying and then the bone is forming, like the process happens in the long bones. And endochondral ossification is affected in achondroplasia. So we will see short stature and but the torso will be normal.
Yes.
Yeah, and no disability, no intellectual disability, nothing. And next is osteogenesis imperfecta. So it is like imperfecta I, it is defect in the type 1 collagen, which is present in the bones. So the patient will present with multiple fractures, and it is also present in sclera. So the sclera will be thinned, and because of the thinning of sclera, there is exposure of the choroidal veins, due to which we have blue sclera. And it can also affect the ear ossicles, so we will have hearing impairment as well. Okay. Then next was osteopetrosis. So in osteopetrosis, we have like the poor osteoclastic activity. So the osteoblastic activity is increasing. It is taking up the activity increased. And so we have like a thickened bone, but it is not very strong. So it will like break easily.
Yes.
Yeah, and the osteoblastic means like bone formation, alkaline. It happens in the alkaline environment, and the acidic environment favors the osteoclastic activity.
Yes.
So yeah, so if we in mutations of carbonic anhydrase, the acidic environment.
Okay, what's the function of carbonic anhydrase?
Okay, carbonic anhydrase will mediate this whole process, CO2 combining with water, H2CO3 forming, and then one proton is forming, one bicarb is forming. So H plus is getting out and bicarb is getting reabsorbed. So if there is a mutation of carbonic anhydrase, so the bicarb is not getting reabsorbed, so it will lead to acidosis, tubular acidosis.
Perfect.
Yeah.
Okay.
And also,
what's the treatment?
Treatment, we will give the bone marrow transplantation, because there is
Why?
Because the osteoclasts are not functioning properly over here. So if we give the fresh bone marrow, so it will form new monocytes and new macrophages, and osteoclasts are basically the macrophages of the bone. So
Yes,
they will form
perfect.
fresh osteoclasts and everything.
Okay, perfect.
Yeah.
We'll also be seeing some vision, hearing loss, hydrocephalus. Why?
Hydrocephalus, because there is too much of osteoblastic activity. It is forming, it is compressing the medullary portion of the bone. And yeah, and similarly in other bony places, like in the foramen magnum, that is getting compressed, so there is like fluid buildup all around the brain.
Yes.
You will see hydrocephalus.
Okay, perfect.
Yeah.
And optic nerve impingement or
Optic nerve
vestibular.
impingement, will lead to vision impairment.
Okay. Okay. What about rickets and osteomalacia.
Rickets and osteomalacia, okay, it happens because of vitamin D deficiency, and rickets is seen in children and osteomalacia seen in adults. So basically, after the osteoblasts, they first to form an osteoid will undergo mineralization steps, and then a mature bone is formed.
Okay.
So, yeah, so here osteoblast is functioning properly, but there is like defective mineralization.
Okay.
And
Perfect.
yeah, and in children less than 1 year, we'll see pigeon chest deformity, which is like sternum is going inwards and the ribs are going outwards. And then
Okay.
we'll see frontal bossing and rachitic rosary, like there are like osteoids on the costochondral junction, which appears like
Okay.
rings of the rosary.
Yes.
And if those osteoids, if they land up in the lower limbs, in the legs, so it will cause bowing of the legs. And
Yes.
and the lab values will be the calcium and phosphate will be reduced. So if the calcium is reduced, so the PTH will increase. And
Yes.
since osteoblasts are like working too much, so ALP will also be increased.
Perfect.
Yeah.
What
Then
about osteoporosis?
osteoporosis is like reduction in the bone mass, in the trabecular bone mass. The
Okay.
peak of the bone mass is around 30 years of age, when someone is like exercising properly, taking proper diet, and genes also play a role in this.
Yes.
Okay. So what all the lab values here will be normal, like calcium, phosphate, PTH, and ALP. Everything is normal. So in these patients, we will give thiazide diuretics as they cause increase calcium reabsorption
Yes.
from the tubule. And estrogens have a protective effect, and steroids like destroy the
Okay. Perfect. Okay. What about Paget disease?
Paget's disease, we can remember like packet. So C in the packet reminds that there is like increase in the osteoclastic activity. So bone is getting eaten up. So the osteoblasts will start building up the bone, but while doing this, it is doing it in a rush. So we will not have a very strong bone, very weak bone is formed. Therefore, we'll have bone pain and frequent fractures will be there. And increase in the hat size and lion-like faces, leonine facies. And
Okay.
everything will be normal except for the ALP, it will be increased.
Yes.
Mhm.
Okay.
And
Perfect.
yeah,
So now let's discuss the last pathology, that is osteomyelitis. Okay, what happens in osteomyelitis? Basically, it's an infection. It's an infection of your marrow and bone. So if it's an infection, it means there are certain causes. It can be caused by bacteria, right? It's a bacterial infection. So how does the bacteria go into your bone? Through hematologic. Like it's a hematologist spread. So in the blood, like for example, you have blood supply to your bones too, right? So for example, if someone is having bacterial infection, so that bacteria can enter your bone and it can seeds there in the bone. So for example, this is your bone, let's suppose, right? So you have a growth plate here, right? And this region of growth plate is basically known as metaphysis, right?
Mhm.
Okay. Region above the growth plate is basically known as,
epiphysis,
and below the this
diaphysis,
growth plate is your diaphysis, right? So in children, basically you are going to see the seeding of this bacteria in metaphysis, right?
Mhm.
Okay. In adults, you are going to see seeding of that bacteria in the epiphysis. So epiphysis for, okay, just call them adults,
Mhm.
right? So epiphysis, you are going to see seeding of that bacteria. So can you tell me some of the common bacteria which causes osteomyelitis? Yes, the
Staph
most common
aureus.
one. Yes, perfect. Staph aureus. Okay, what about gonorrhea? Neisseria gonorrhea. Have you done the micro portion?
Mhm.
It causes arthritis, septic
Yes.
arthritis, if you guys remembered, right?
Mhm.
So, and okay, what about
Pseudomonas or
Pasteurella?
Pasturella.
Okay, it's basically associated with cat and dog bite, right?
Dog bite.
Okay, you're going to see this MCQ. Okay, then you have tuberculosis. We just discussed tuberculosis. Whenever the TB spread to vertebra, what's the name for that?
Pots.
Pot spine.
Pott's disease. Okay, so if we have infection, so it's obvious you are going to see certain signs in infection. For example, you are going to see fever, right? The white blood cells count increases. Okay. Hello, and again you are going to see sclerosis of the bone, that is lytic focus inside the bone. Like for example, if I am just what happens that here it's just this bacterial here we have bacteria, you are going to see inflammation here, right? And it's going to lead to necrosis. So the surrounding area is going to become sclerotic. You are going to see reactive bone formation, right? So how to diagnose? Just do blood culture, right? In order to see which bacteria is seeding inside your bone. So guys, it was all for today. We are going to do the little chunk, that is bone tumors, tomorrow. And like today I was just preparing the neurology. I was just finding some notes, so I just found good notes for your neuroanatomy. And like it's
From
a
where
handwritten
exactly?
notes, right? It's handwritten notes, like I just wrote it by my own from Dr. Najib. Do you know Dr. Najib?
Yeah.
Yes. So I just write it down from that resource. So we are going to follow those notes in our anatomy portion, right?
Okay.
Yes, because I have just seen a lot of resources. Like it's very explanatory. So once you know the anatomy portion of neurology, then you already know the pathology. That's very easy, right? Like for example, if you know
Doctor,
what
can
are
you
ring short
explain
cells.
the aviation sort of a thing? Which pathology of aviation?
Sorry, I can't hear you well.
Can you hear me?
Yes.
Yes. So one of the we were talking about aviation in the last topic.
Yes.
What was that?
It was Paget disease, right? And it leads to aviations, right?
How
Yes.
Your voice is too low, Dr. Talia. Can you please fix it? Shall I repeat that concept, right?
Yes.
Okay. So, in Paget disease, what happens? You are going to see increased activity of osteoblasts, right? Osteoblasts are going to lay down more osteoids. If I am laying down more osteoid in a mosaic pattern, like irregular pattern, so it means that, okay, just have a concept of it. Your bone have blood vessels too, right? And if I am just disrupting all of the things around these blood vessels, so it can cut off some blood vessels, right? The veins, the arteries, and whenever the arteries and veins are then joined, okay, it leads to AV shunts. That is arteries and veins, whenever they are joined with one another, it's known as AV shunts, arteriovenous shunts. Why? Because the process here going on, you can see the increased osteoblastic activity is going to form the osteoid in a really disrupted manner. So it can disrupt the blood vessels in the bone. And whenever they are disrupted, you are having increased chances of AV shunts formation. And if you have increased AV shunts, it means the overall resistance to your heart is decreased. Okay, you are going to see less systemic vascular resistance, or you are going to see more blood entering into your venous side, right? Or more blood entering your venous side, so your heart is going to deal with more blood. That is high cardiac output failure. More blood, more output. More blood, more output. So ultimately your heart can fail. It's basically known as high output cardiac failure due to AV shunts. Okay. Okay, and guys, we have also launched the hello.
Yeah, someone just
Okay.
raised their hand, I guess.
Yes, Dr. N.A. Okay.
Yes, thank you. So I was wondering if you could give us the corresponding Bots and Beyond videos for the neurology questions. You've given us the parts to study of first aid, but I wanted to know if you had the corresponding videos for Bots and Beyond.
Okay. So I'll just mention those videos in the daily schedule. But yes, you guys can see those. But I was planning to give a lecture on that. So okay, you guys can just do it from boards and beyonds as well.
No,
I'll
no,
be
we want
giving
your
the lecture.
lecture also.
Okay. No, I'll be giving the lecture, but yes, I'll just send the corresponding video. So we have launched the
Thank you.
self-assessments. So I think today or tomorrow it would be activated. So you guys can then check your subscriptions, and you just guys can just test that, right? So we have
Okay.
launched the self-assessments as well. Okay.
Doctor, any update about the flashcards?
Flashcards, yes. Like I'm onto it, and I'm working on the flashcards. And once they're completed, like I have a lot of things to do now. Sorry for that. Like
Okay.
it's like this 100 days marathon, like it's an initiative, right? It was like entirely new thing, and we were just like focusing on that. So I'm just trying to add as much as things as I can, right? The flashcards, the self assessments, all of things. So sorry if
Okay.
I'm getting delayed, so you guys know that I'm just also extending my team in order to recruit more people to have a well organized schedules, and the so
Okay.
sorry if you guys have some
Sir, when are you going to discuss the NBME question you said before?
Okay, NBMEs. We are going to give NBMEs. Okay, so so I'm planning that what if we just do half of the neurology, like the neuroanatomy, then we can start doing NBMEs because you have a lot of chunk from neuro section, right?
Yes.
Yes.
Yeah.
So it would be good that if once we do even half of neurology, then we can just start giving NBMEs.
Okay.
Sure.
Okay, sir. Yeah.
Okay. So yes, slides. I would just send you those slides. Okay, I have those slides. I'll just send you right after the class.
Thank you.
Thank you, sir.
Okay. So thank you guys. Thank you.
Thank you.
Thank you, Dr. Ahmed.
Thank you.
Hello,
Yeah.
self-assessments means like a full-length self-assessments.
Yes, it's you word self assessment.
Oh, okay. Or till the systems we have completed, or is it the full one?
It's full self assessment of you word. Like you word
Oh,
offers you
okay.
self assessments, right? We have also
Okay,
just
that way.
launched those self assessments as well, so you can check on your subscription.
And sir,
Okay.
if we want to attend it in the last, will it be available or is it time limited?
Yes, it's available for no, like you have 3 months of subscription, right? So you have validity till your last day. You can just
So
attend
is
it.
it December end or? Uh,
It's your December end. Yes.
oh, okay. Thank you, sir.
That isn't any issue. I would just extend that. Don't worry about that.
Okay. And sir, what about tomorrow's timing? Is it same as today or is it earlier?
No, I would just take it 1 hour earlier because, like, as I have already told you guys, that I'm having like a lot of things like I'm doing at once. So therefore, I just got 1 hour late. So tomorrow we are going to start it on our time, right?
Like 12 p.m. EST?
Yes, we are going to start on that time.
But sir, actually, 1 hour earlier from today, right?
Yes, 1 hour earlier from today. Yes.
Because we have time changes in here USA, so it would be 11 p.m. EST if 1 hour earlier.
Sure.
So
I'll use.
because that way some students had missed lecture on first day.
Okay. So we
It's
already have
just
the
to,
recording. I'm sorry for being late for 1 hour, but I was having some work, as I have already told you guys.
but
Like I'm working on a lot of things, and like as currently I was also working on the self-assessment, but I haven't told you guys. Like now I am done with that work, so we have launched it, and you guys can then
yeah.
just test that, right?
Thank you. So actually, it helped us here 1 hour later because here time changed occurred. So 1 hour later was still 12 p.m. for us. So from 2-3 days, time change has occurred.
Okay. So
So
we
that's
are
why I
going to.
was confirming. So 1 hour earlier from today's timing, right?
Yes, 1 hour earlier from today's time.
Okay, and will it be for 2 hours approximately,
Yes,
or 1 hour?
yes, it would be 2 hours because okay, if yeah, if we
Approximately, if it's less or more, it's
yes, it
fine.
would
But
be approximately 2 hours because I'm like, as I have already told you guys, we are going to refer to those notes. I'll be sharing those notes, and they're like very explanatory kind of notes. So if you know the pathways, for example, in the basal ganglia, then you can easily, like in my thinking, that you must know the basics well in neuroanatomy, right? So
Yeah.
I'll be focusing on that. So we'll be taking long sessions.
okay, okay.
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 So thank you
And
guys.
Dr. Ahmed, so
Yes.
after neurology, we'll start NBMEs and we will not do GIT because you said GIT.
No, we will do GIT, but
Okay.
we'll just start doing our NBMEs. We would start.
Okay, so like parallelly we'll do both. Okay.
Yes, we'll do it parallelly. Like right after this, I'm not like in favor of taking individual assessments,
Mm-hmm.
right? So it's better to give time to NBMEs and focus on their
Yes,
explanation,
yes.
right?
That's a good approach. Yeah.
Yes.
Okay.
So, any
Thank you.
questions?
Mm.
Okay, doctor. What Dr. R.A.K. is saying? Yes. Okay, so yeah, if you could sing out. Okay, so we are going to take our class on the same timing. I'll just share the timings with you guys, so don't worry. Okay.
Mm-hmm.
Thank you.
Okay, thank you guys. Thank you. Have a nice day.
Thank you, Dr. Ahmed.
Thank you.